What is the difference? Pap smear screening versus cervical cancer diagnosis. Imagine catching a problem early before it becomes serious. That's what a pap smear screening is all about. It's a simple, routine test used to check the health of your cervix by collecting cells from the surface. The goal is to find abnormal or precancerous cells early, often before symptoms appear. This screening is recommended for people with a cervix starting at age 21. If your results are normal, you usually get tested every 3 years. For those aged 30 to 65, options include a pap smear alone every 3 years, an HPV test alone every 5 years, or both tests combined every 5 years. The main purpose is to detect changes caused by the human papillomavirus, which is the main cause of cervical cancer, so they can be treated early and prevent cancer from developing. Now, if a pap smear shows abnormal results, or if you develop symptoms like unusual bleeding or pain, that's when a cervical cancer diagnosis might happen. Diagnosis is the process of confirming whether cancer is actually present. After an abnormal screening, doctors may perform a colposcopy, which is a detailed examination of the cervix using a special magnifying instrument. They might also take a biopsy, which involves removing a small piece of cervical tissue for microscopic analysis. Sometimes imaging tests are used to see how far the cancer has spread. Diagnosis is essential because it confirms the presence of cancer, determines its type and stage, and helps guide treatment options. So, the key difference is purpose. Pap smear screening is a preventive step aimed at catching abnormal cells early, before they turn into cancer. It's part of routine health checks for people with a cervix and helps prevent many cases of cervical cancer. On the other hand, cervical cancer diagnosis is a follow-up process that confirms whether cancer is present after abnormal screening results or symptoms. It involves more detailed tests to understand the extent of the disease. Screening is done regularly and is usually asymptomatic, meaning you don't feel anything wrong. Diagnosis happens when there are signs or abnormal screening results that need further investigation. The methods differ too. Pap smears look at cells under a microscope, while diagnosis involves biopsies and imaging to get a clear picture of the cancer's presence and spread. Both steps are vital parts of cervical cancer control. Screening helps catch problems early and saves lives by preventing cancer from developing. Diagnosis confirms if cancer is there and helps plan treatment. They work together as part of a comprehensive approach that also includes HPV vaccination and follow-up care. Remember, always consult healthcare professionals for personalized advice and screening schedules suited to your health needs. Regular screening and timely diagnosis are your best tools in fighting cervical cancer effectively.